My name is Suzanne D. Crane. I'm the Vice President of Mission Integration at St. Joe's Medical Center. I'm also the Director of Spiritual Care, and it's my pleasure to welcome this group back again to St. Joseph Medical Center. You were here 2 years ago for the first Symposium of Catholic Medical Professionals. So it was an honor to host the first one, and it's a delight to welcome you back. I want to extend the welcome of our Chief Executive Officer, Jeffrey Norman, the rest of the executive team, and truly the whole hospital staff. They know you're here. They've taken a great interest in who you are and what you're doing here on a Saturday. And they have worked very hard to make this a space that's comfortable for you to be in. Archbishop O'Brien, thank you for gracing us with your presence. It's an honor to have you here. Our speakers, thank you for giving your Saturday to this wonderful venture also. Your topic this year, healthcare reform, is one that certainly provoked enormous discussion and strong feelings as it's been debated over the past months. My hope is that your conversation today will be vigorous and strong and fruitful for all of you who are here. Here at St. Joseph Medical Center, we see the effects of lack of health care on our patients and on our desire to always provide their services, even for those who don't have financial means. Last year alone, at St. Joseph, we provided nearly $4 million of charity care for nearly 3,000 patients, not including the unpaid costs of public programs like Medicaid. We see people seeking treatment at a point in a disease when earlier treatment would have given them a dramatically different prognosis. We have people using our emergency department as their source of primary care because they have no health insurance coverage and no physician who sees them regularly. We struggle to meet the prescription needs of patients who are leaving, and they need these prescriptions as a matter of their survival as they're discharged, but the cost of the drugs is unimaginable for the patients and their families. I dream of a day when healthcare is available to all the people in this country, providing appropriate and timely care. I dream of a day when care is solely guided by respect for life from its first moments until the moment that life returns to God. I dream of a day when people don't have to make choices between food and medicine. I dream of a day when respect for issues of conscience are simply understood and honored as a matter of course in our healthcare policies. At St. Joseph Medical Center, we consider ourselves blessed to work in a Catholic healthcare facility that has existed in Baltimore for 147 years. We are guided by the Catholic healthcare tradition and by the ethical and religious directives. And we find particularly that the first of the normative principles described in Part 1, Social Justice, of the ERDs is a clarion call for the type of social response to healthcare needs in this country that we hope for. The ERDs say, Catholic healthcare ministry is rooted in a commitment to promote and defend human dignity. This is the foundation of its concern to respect the sacredness of every human life from the moment of conception until death. The first right of the human person is the right to life, and it entails the right to the means of the proper development of life, such as adequate health care. Please be at home while you are here. There is a bathroom in the back of this room, sort of behind that little half wall right there. It's a unisex bathroom. But if you go out the cafeteria doors and go straight ahead, in back of the registration tables where you signed in, there is a men's room and a woman's room back there. If you have time to visit the chapel, you'll find it a quiet, prayerful, peaceful atmosphere. And if you would like to go into the meditation garden, you open the wooden doors as if you're going to the chapel, and the doors to the garden will be right there on your left. This is a very, very well-used space, our meditation garden. Families are out there. They push patients out there with IV poles. Staff are out there in their scrubs, so this is a very well-used space. I wish you a fruitful afternoon, and again, a welcome on behalf of our entire hospital staff. Welcome.
Thank you for your welcome, and I echo your welcome to all our guests today. How many are here for the first time? This is our third. Good, that's wonderful. Thank you. Glad you're with us. We'll start with the prayer of the Catholic Doctor by Pope John Paul. Let us pray. Divine Physician, who in your earthly life showed special concern for those who suffer and entrusted to your disciples the ministry of healing, make us ever ready to alleviate the trials of our brethren. Make each one of us aware of the great mission that is entrusted to him. Strive always to be, in the performance of daily service, an instrument of your merciful love. Enlighten our minds, guide our hands, make our hearts diligent and compassionate. Ensure that in every patient we know how to discern the features of your divine face. You who are the way, provide us with the gifts of knowing how to imitate you every day as medical professionals, not only of the body but of the whole person, helping those who are sick to tread with trust their own earthly path until the moment of their encounter with you. You who are the truth, provide us with the gift of wisdom and science in order to penetrate the mystery of the human person and their transcendent destiny as we draw near to them, in order to discover the causes of their maladies and find suitable remedies. You who are the life, provide us with the gift of preaching and bearing witness to the gospel of life in our profession, committing ourselves to defending it always from conception to its natural death, and to respect the dignity of every human being, and especially the dignity of the weakest and the most in need. Make us, O Lord, good Samaritans, ready to welcome, treat, and console those we encounter in our work. Following an example of the holy medical doctors who have preceded us, help us to offer our generous contribution to the constant renewal of healthcare structures. Bless our studies and our professions, enlighten our research and our teaching. Lastly, grant to us, having constantly loved and served you in our suffering brethren, that at the end of our earthly pilgrimage we may contemplate your glorious countenance and experience the joy of the encounter with you in your kingdom of joy and everlasting peace. Amen. The landscape of healthcare has changed dramatically since our last symposium, as we know. We continue to seek to understand the scope of the new legislation in healthcare, especially as it affects the lives of the most vulnerable and its impact on the conscience protections you Catholic medical professionals hold dear. So we come together today, led by an esteemed panel of speakers who will help us to discuss these weighty issues and to appeal to the Holy Spirit and your patron, St. Luke, for open minds and hearts. I invite you to reflect prayerfully on your noble role as health care professionals, our roles in bringing about the kind of reform that respects the dignity of each human person, how reform will affect your roles as healers, and your continued commitment to model your vocations after the divine healer. This afternoon, I'd like to thank our sponsors, St. Joseph's Medical Center, St. Agnes Hospital, Bon Secours, Baltimore Health System, Mercy Medical Center, and Good Samaritan Hospital. They've been very generous each of these years, and some of their leadership is here today. We're most grateful. I'm pleased to be able to welcome our speakers, Anthony Picarello, Father McLean Cummings, Dr. Louis Bresci, Dr. Marie Hilliard. Now please join me in welcoming our first speaker, Mr. and Dr. Anthony Picarello, General Counsel for our Catholic Conference of Bishops. Prior to his role there, he served as Vice President and General Counsel of the Becket Fund for Religious Liberty, which most of you are aware of, I think, where he enhanced the firm's reputation for excellence in litigation under the free speech, free exercise, and establishment clauses of the First Amendment, as well as Title VII of the Civil Rights Act of 1964. He's published and lectured on various religious topics for academic, legal practitioner, and general audiences. Anthony graduated magna cum laude from Harvard, earned a master's degree in religious studies from the University of Chicago Divinity School, and received his Juris Doctor from the University of Virginia Law School. He's a member of the U.S. Bar of the Supreme Court and all federal courts of appeals. We welcome Mr. Anthony Picarello.
Thank you, Archbishop, and thank you again for coming. I hope you can hear me all right, and if you can't, just start waving your hands. I'm not going to treat those as requests for questions because we're going to have Q&A at the end, but healthcare reform, lots of pages, as you heard. It's the kind of thing that I don't think anybody can claim to understand fully, but there is a slice of it that folks in my office and my other colleagues at the conference have tried very hard to understand very well, and that has to do with the moral questions that were of concern to all of the bishops, I think, as that law was being considered. And as you may recall, ultimately the bishops were kind of in a bad position and had to oppose the bill despite a general interest in wanting to see healthcare reform and universal coverage because of these considerations associated with, as we'll discuss, immigration, conscience issues, and abortion funding questions. So I would like to try to unpack those a little bit, explain what's going on, and then also talk a little bit about the debate, get a bit meta, if you will, have a debate about the debate, because some of those conversations, other than just the nuts and bolts of, who's right and who's wrong legally, I think are worth reflecting on, because I'm not sure that debate is over, and I'm not sure it exactly went as it should. So in any event, I'd like to try to shed a little light on that as well. And with that, off we go. So try to keep that within mouth reach. All right. I'm going to talk about moral problems other than abortion funding first. And those are conscience protection outside the abortion context, justice for immigrants. Then we're going to move on to the big kahuna, abortion funding, and persistent doubts about that. And this is going to reflect a little bit on the debate as it happened, but also on some of the subsequent experience that we have, even in the short time since the law has passed, that tends to confirm our view that, in fact, the bill does tend to fund abortion. Then again, this is the meta conversation I was talking about, the distinct role of lawyers and bishops, because that came up. I would say lawyers and analysts are kind of the folks on the lay side of the house at the conference and more broadly in the debate, and the bishops and clergy who have a distinct role as well. So that's where we're going, so let's go there. Problems other than abortion. Conscience protection beyond abortion, first of those. Now, what are we worried about? What are the procedures where there might be conscience problems under the bill? In short, things like sterilization, in vitro fertilization, gender change surgery, contraception, and others. These are Catholic concerns, but they're not just Catholic concerns. The problem is structural. It's not oriented toward a mandate to any particular service. It's the fact that there's no conscience exception for any service that you might be compelled to provide. And there are a lot of mandates. We're in a new world with this bill where there are mandates to provide coverage, which by and large are a good thing, but when you don't have exceptions for conscience, then you have problems. So again, that's what I'm referring to here. You have new mandates to provide coverage for certain procedures without room to accommodate conscience, and frankly, at any level in the food chain, as it were, the insurers, the plan sponsors or the employers, the plan purchasers, the individual employees, or the individual service providers. Now, most of the law has to do with regulating insurers, so it would require insurers to provide only coverage of these things that nobody wants to buy the coverage for. And if people have coverage for it, then they expect to be able to get the coverage somewhere. So that's how it kind of gets down to the provider level and the recipient level. So essentially, you're dealing with coverage mandates. That's the principal problem. Now, what are the solutions to this problem? There was actually a fairly straightforward solution, which is just to not prohibit insurers from making those accommodations. And that is the world we live in now, or you might say before March of last year. Because what happens is, let's say I work for, the U.S. Catholic Conference, and I'm the person responsible for purchasing their health insurance, and I don't want to buy coverage for my employees for abortion or contraception or any of these other things. But since we're putting aside abortion for now, let's say, again, contraception, sterilization, so forth. I don't want to buy those services. Right now, I go to a bunch of potential insurers, and I say, write me up a policy that covers everything but this. And I get a few bids, I pick the bid I want, everything is fine. You could call that an accommodation, I guess, but it's really just kind of the market at work, right? It's just somebody saying, I want this service, and then they get it provided by whomever might be in a position to do it. Now, in a situation where we have mandates, you can't just go out there and say, I want A, B, and C, but not D. You're required, the government is telling you what you have to have in that coverage. And again, you don't have the option to do it. And when you're talking about relief from a government mandate, that's when the language of accommodation begins to come up. So what you can do is basically say, to the extent that people have, a bona fide religious exception, that insurers are free to basically deal with them in the way that they want to be dealt with. It's not revolutionary. In fact, it's the opposite. It's the idea. It's perpetuating the status quo rather than altering it. That was the proposal. What happened when we raised this? Crickets chirping, tumbleweeds in the streets, however you want to put it. I mean, essentially, so many eyes were focused on the question of abortion funding that when we raised this, you had more the situation where people didn't even want to engage the question because that kept it low profile. There weren't big fights about this because nobody took up the other side. And nobody took up the other side because it was just easy to ignore it. But already, that's the general structure of the problem, you might say. It's already starting to materialize. So again, we're moving out of the realm of the abstract, the potential, the speculative, into the concrete and the real. And here's where it shows up. There's a category in the law called preventive services. And those are good things, by and large. It's something that folks in the healthcare, I think, are enthusiastic about having provided. It's things like mammograms and colonoscopies and things designed to identify diseases early. And the idea of preventive services as it appears in the statute is to identify that category and then make those services, again, in a mandatory way, copay free. This is, I'm sure there's some technical term, but the idea is if you go in and you get these services from your doctor, you don't have to pay your 10, 25, 50 bucks, whatever it is. And of course, they're required. Now that's great if you're talking about things that are licit, because they actually do prevent diseases. It, so to speak, bends the cost curve, right? Because you're getting out in front of these things. All that makes good sense. Here's the problem. Planned Parenthood comes along and says, preventive services, I know what I want to prevent, pregnancy. Contraception prevents pregnancy, right? It's a preventive service. Problem is, pregnancy isn't a disease. So it ought not to fall within the category of preventive services. And we've made that argument in regulatory comments and so forth. The problem is we're not also the decision makers, so it may go the other way, and preventive services may well be construed so broadly as to include things that are things that we can't do. So again, we've given them reasons. We haven't just said, no, it's going to hurt us. We say, preventive, you're not preventing a disease here. And we haven't heard back yet. Basically, this has still been a regulatory fight. There have been folks on the Planned Parenthood side of the ledger who have been lobbying very hard in very public ways. There have been hearings and stuff like that at the various National Institutes of Health. I think it's basically a related agency where they're kind of lobbying hard for this category to include contraceptives. And it's just not clear how it's going to be decided. I'm not optimistic, but again, the purpose here is to show how you've got an overall structural problem in the statute. You already have a particular iteration of it where the other shoe's about to drop. I hope it doesn't, but I'm not optimistic. But again, this is not the land of make-believe. This isn't lawyers kind of getting way out ahead of something. This is real. It's already starting to happen. Give it another 6 months and maybe we'll be hearing some more about it. Okay. Another problem, moral problem, identified by the bishops about the law, other than abortion. Justice for immigrants. There are two problems under this category. The first is that the bill prevents illegal immigrants from buying with their own funds without subsidy. So, and the House bill would have allowed this. So here's the issue. I think the conference seemed quite comfortable with the idea that for undocumented persons, they should not get the subsidy associated with health care reform. That's fine. Everybody's fine with that. Being documented or undocumented has to have some important consequences, and that's one of them. Okay. But the idea is that when you have undocumented people in this country, they still get sick. They still show up, including at your hospitals, perhaps especially at your hospitals. And this would have given them the option to pay their own way. This basically would have let them in. to cover their own costs. So you'd think that the folks who were really hostile to immigration would have liked this. Because the complaint is, oh, they're just mooching, they're drawing down on the system. Well, here's a solution. Let them pay for themselves. Let them pay for themselves, without subsidy, no less. That was in the House bill. We liked it in the House bill. We said we liked it in the House bill. Got stripped out in the Senate bill. And that's a problem, because what do you have? You have, essentially, not only, you have two problems. You have the likelihood that undocumented persons will get less care, and you have the likelihood that the care that they do get is going to get borne by you all and the taxpayer. So it's a lose-lose. Again, the statements that came out of the conference identified this problem, talked about it. Nobody, again, on the other side, crickets chirping. You just didn't, you didn't hear folks who were otherwise supporting the law willing to acknowledge this problem and at least do enough to fix it. But, all right. Okay, here's another thing. Right now, and this has been the case, it continues to be the case, if you are legal, if you are documented, you are prohibited from participating in Medicare for 5 years. Medicaid for 5 years. That's unfortunate. I mean, you're legal, you're in, you're playing by the rules, and you can't get Medicaid for 5 years. Don't do that. That was on the table. It was an amendment. When it was proposed an amendment, the bishop said, this is a great amendment, it should be included. Rejected in the Senate. So, again, we try, all people hear about is the abortion stuff, but there's other very meaningful moral issues that were emphasized by the bishops and just didn't get much purchase. And so when they oppose it, the fact that this was part of the basis for that opposition is ignored, unfortunately. Okay. So we've talked about all the stuff that nobody's talked about, which are the problems other than abortion, which are quite serious and perhaps justify opposing the bill by themselves. But what had the high profile, what's caused all the fracas is abortion funding. Now again, in broad outline, let me describe the nature of the problem here, why we expect, or why we did expect, and we're already sort of, again, it's already starting to happen, but why we initially expected the law, the Patient Protection and Affordable Care Act, PPACA, as I like to call it, why we expected it to fund abortions. Now, courts read statutory language that provides for very broad categories of service that might include abortion to include abortion. So if you have a statute that says, thou shalt fund women's health, thou shalt fund family planning, categories of this sort, where you could make an argument that it includes abortion, courts consistently construe those things to include abortion. You have litigation where folks have said, no, we don't want this to include abortion, and they get rejected over and over and over again. It's precisely because of that, the courts have said, okay, if you have these broader categories, we're going to construe it to include abortion, but Congress can explicitly rebut that presumption, right? Congress can carve abortion out. It can set up these broad categories and say, but we don't want to have abortion. And the courts will respect that when it happens. That's why we have the Hyde Amendment. That's where the Hyde Amendment came from. The Hyde Amendment, got rolling in the early mid-'70s precisely because there were a series of judicial decisions that construed these laws that really weren't intended to cover abortion, but construed them broadly to include abortion, and in a mandatory way, absent an express congressional exception. So what did Congress do? It provided the express exception. So that's kind of the landscape that we're dealing with. The jurisprudential landscape, so to speak. It's the way courts have tended to interpret healthcare laws like this. So along comes this new healthcare law, and it provides broad categories. So what's going to happen? It's going to fund abortion. Well, so unless there are express exceptions. And there are, but they are limited in scope. So this is, again, big bill, thousands of pages or whatever, hundreds of pages. And it has different funding streams. It has different funding streams that I think we've yet to discover. They're buried somewhere in that jungle. What would have worked would have been a law that said anything in this act, any funding stream, any dollars, may not be used to cover abortion. That was the Stupak Amendment. Straightforward, clear, direct, act-wide, no problem, right? basically took the Hyde Amendment language in the same words, cut and paste, boom. But no. What ended up happening was there were certain carve-outs that limited abortion funding flowing for abortion, and in kind of dubious ways. But let's put aside that little quibble, because there's a bigger problem, which is that huge swaths of the act, huge funding streams, are wholly uncovered even by these little carve-outs that are there. So the carve-outs are of dubious quality, and most importantly, they don't cover the whole act. So rather than just kind of speak in the abstract about the possibility that there might be some funding stream somewhere that isn't covered, well, there's one in particular that is a large amount of money. It's, I think, the statute over a period of 10 years appropriated like $11 billion or $9 billion, something on that order, lots of money to community health centers, CHCs. And the kinds of funding restrictions that are in the act don't cover it. They don't cover it. They don't reach that far. Now, again, you'd say, well, why doesn't the Hyde Amendment cover this? Doesn't the Hyde Amendment, isn't that already in existence? Doesn't that already prohibit funds from going to abortion from the federal government? No, and the reason is that the Hyde Amendment is not some statute that's permanent and always there and always covers every federal dollar that goes out to healthcare. No. The Hyde Amendment is an annually renewed law. It's called an appropriations rider. So it's tacked on to annual particular appropriations every year, year after year. So put it in other terms, every year we at the conference have to fight to get the Hyde Amendment in there. Now, we've succeeded 37 years in a row, or whatever it is, but we've had to fight for it every single year. It's not baseline. It's only baseline as a result of those annual fights. And it's tied to particular funding streams. And to be sure, those funding streams are the bulk of the relevant ones: the Department of Health and Human Services and the Department of Labor. But that is just those two. It's not everything. And it's their annual budget as opposed to other particular appropriations that may come separately, such as, from the healthcare reform law, which sets up its own appropriations. It doesn't just set up kind of what happens in the budget in years to come. It makes its own appropriations. It's a different funding stream. It's a funding stream that is not covered by the Hyde Amendment and therefore is not restricted in the way that the Hyde Amendment would restrict it. Some folks have said, well, there are regulations that HHS has to follow, that restrict funding of abortion. Well, that's true, but it's true only to the extent that they are administering funds that are part of their annual appropriation that's covered by the Hyde Amendment. If they try to apply the regulatory restrictions that are based on the Hyde Amendment to funds that the Hyde Amendment doesn't cover, they'll get challenged in court by Planned Parenthood or NARAL or whomever, and they will lose. So even if you have a very willing administration, which you may or may not have, perhaps not, but let's say best case scenario, they're not the ultimate decision maker. It's going to be the courts driven by people suing them. Okay. So some folks have said, all right, well, okay, maybe there's that overall structure, but isn't it the case that you have these two funding streams, but they all kind of get thrown into the same pot? You got your Hyde restricted funds and you've got your PPACA unrestricted funds, but then once you throw them in the pot, they're commingled, and doesn't that mean that the restriction applies to all of them? Well, there's no general rule to this effect. It's not like you have accountants who can't keep track of the money. It's like does not compute. You see the smoke coming out of their ears. They just can't handle the idea that there are two different funding streams put into the same pot. No, they can keep track of them. They can distinguish them, and they can be capped differently. That's not a problem. What folks are talking about instead is the fact that there's particular language in the Hyde Amendment, the annual Hyde Amendment year after year, that says under certain limited circumstances, the restrictions associated with Hyde can be extended to other funds. But that is only if the Hyde restricted funds are appropriated to the unrestricted funds. So essentially you have to have like a pool of unrestricted funds, like the PPACA funds, just kind of lying around. And along comes Hyde Amendment, and it throws, or Hyde Amendment restricted funds, and they're kind of thrown in on top of it. But that's not the structure here. I mean, you can imagine, maybe it would be possible, I don't know if the law allows for it, but somebody kind of goes around with sort of like a little eyedropper full of Hyde restricted funds, and they find all these little PPACA things, go boop, 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 and they poison all those wells, so to speak. In other words, they restrict all of them that way. But that is not the way these funds are structured under the statute. I don't know, I have no reason to believe that there is administrative discretion that allows for that kind of an arrangement. And nobody, though it would be very much in their advantage to say how, nobody has come forward and explained how that is. So, yeah, and then there's also the question of whether it's a trust fund within the meaning of the statute. So again, yes, under certain limited circumstances, commingling can make a difference, but no, these particular circumstances are not those. All right. So here's another question that you hear coming from time to time. Doesn't the executive order fix the problem? You remember Congressman Stupak kind of held the line, and then at the last minute came around and said, well, we got this executive order, we're set, no problem. No. There's something in the Constitution called the separation of powers. And it assigns to the legislature the power to legislate, and it assigns the executive the power to faithfully execute the laws, not to legislate. So basically, what that means is the president cannot arrogate to himself the role of the legislature and cannot override contradictory legislative mandates. Now, the Stupak Amendment was, shall we say, the question was asked and answered. It was raised, it actually it passed in the House, but then it was rejected specifically in the Senate. So to go around and say, well, they really meant to have it in there after all, and that's the way we're going to construe it, like I said, it's just like the other matter before that I was telling you about, the commingling question. Even with the willing administration, if they were to do that, they would be challenged in court and they would lose, because they'd be exceeding their authority as the executive. You can't step beyond what the statute authorizes. You can't do things in contradiction with the statute, which, as you recall, has broad language that includes abortion, therefore will be construed by courts as requiring the funding of abortion. That mandate cannot be overturned by executive order. It's just beyond the power of the executive branch to do that. So there's another dispute where kind of, again, since the passage of the bill that you might have heard about, it's not so recent anymore, but it pertained to a situation called, or an aspect of the statute called the high-risk pool. And the high risk that's being referred to is the high risk of not being able to get coverage. So it's a pool of funds that the statute sets up, and actually the way it's structured is states set up risk pools on their own, and they get authorization from HHS to do it, and then it gets to be funded by the federal government. And the idea of these pools are to kind of provide a transition for people who will have a really hard time getting coverage because they have pre-existing conditions between now and 2014, when that basically becomes irrelevant. 2014, the mandate kicks in, everybody's covered, everybody has to be covered. But in the meantime, you've got folks who have pre-existing conditions, and so they create this separate high-risk pool for people who wouldn't otherwise be able to get coverage. Again, in concept, we're all for it. That's not a problem. The structure of it is entirely sensible. But what happened was 3 states, New Mexico, Maryland, and Pennsylvania, submitted regulations to HHS for approvals. In other words, they got their state act together, say, okay, we're going to create the high-risk pool. Here, HHS, tell us whether this is okay. And the coverage that they provided included abortion. So, not only that, HHS got these plans, and it approved them. Okay, no problem, sold. Go about your business. Go ahead and begin to implement these pools. And then folks in the pro-life community sort of sniffed this out because they had actually foreseen the problem, so they were waiting to see when it was actually going to materialize. They'd raised it, and again, it was ignored, and so then, sure enough, they just needed to sit back and watch, okay, and sure enough, 3 states right out of the block. They go ahead and propose these things. So they raise the complaint, and HHS is like, oh, no, what are you talking about? This is another exaggeration, distortion. People trying to say that the statute doesn't do blah, 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 blah. It's, besmirching the good name of, et cetera. Okay. Well, pretty soon they changed their tune because they looked into it, and they're like, wait a minute. Uh-oh. We did approve these things. Actually, some of these responses were genuinely funny. The state of Pennsylvania, for example, they said, oh, what are you talking about? This plan doesn't cover abortions. It only covers abortions that are legal in the state of Pennsylvania. well, since Roe v. Wade, that would be all abortions are legal in the state of Pennsylvania. So it's just, anyway, don't get me started. So what happens is HHS realizes they actually do have a problem on their hands. So what do? The secretary issues a statement pledging that the programs will not fund abortions. Now, you might say in the ordinary course that and 50 cents will get you a cup of coffee. No, I should say that and $1.50 will get you a cup of coffee. You know, it's one thing for the HHS secretary to say it. It's another thing for that to have legal effect. Well, here's the thing. In the case of the high-risk pool program, that particular program, again, PAPACA is this huge lumbering beast with many, many facets, and this is just one facet in that program. The regulations that are issued by the secretary or approved, the secretary is given by statute authority to basically impose any other terms or provisions as the secretary shall see fit. In other words, it's sort of like a slush category, a general kind of authorization that gives the secretary a little bit of elbow room just to kind of do whatever it is in their discretion the secretary may see fit. So that just sort of by coincidence happens to exist in this program where we see the first problems right out of the gate. So kind of, in a sense, fortunately for all of us, there is more than zero statutory authority for the secretary to say, well, maybe they propose these things, but I, as the secretary, I'm going to step in and say, but it's not going to fund abortion. Now, it may still be susceptible to challenge, and folks may still come into court and say, well, you have this general authority, but it doesn't extend that far, and maybe they win, maybe they lose. But at least they have a colorable argument. The interesting thing is, what a contrast this is with the whole rest of the statute. You've got this little provision in this little program that gives the secretary the authority to do that, but you don't have it anywhere else in the statute. So if you have a problem like this that crops up somewhere else, say with the community health centers, where we actually see billions of dollars potentially going this way, if the secretary says, wait, I forbid it, I'll say, right, that's a joke. You have no authority whatsoever. Well, here they happen to. So when the secretary came out with that statement, we said, thank you, Madam Secretary. And by the way, we think that this is valid, but only by happenstance. You just kind of happen to stumble into the first problem where you had the authority to do something about it. So once that got fixed, folks who were just advocates of the law, almost regardless of what it said, look, what's the problem? It got fixed. There's no abortion funding. The secretary said that they were going to do it. They kept their word. Well, yeah, they did. And they just so happen to have authority to do it here. But recall, first of all, that the states, who have their own attorneys, by the way, thought that they were authorized to fund abortions. And they sent it into HHS. And they initially said, yep, you can do it. And they approved it. It was only after there was the outcry that there was anything done about it. So the point is, additional administrative action was required. And absent that administrative action, that is to say, if you just have the statute and the executive order, nothing. That's not enough by itself. You need something more. Now, if the statute and the executive order were enough, you wouldn't have needed that. So there again, the statute and the executive order, standing alone, they do fund abortions. Now again, as I mentioned already, that particular HHS action in this particular program context did have statutory basis. You don't have that same statutory basis for the executive order. You don't have a statute-wide basis like that. As I mentioned, this could get tested in court. Maybe they win, maybe they lose. I hope they win. I always hope they win if they push that stuff. If they're willing to stand up and block it. I just think that in this case they have a credible shot. In other cases they don't. And here's another thing. When this issue came up about high-risk pools, some legislators went to the Congressional Research Service, which is, a pretty credible source. And they said, so, for high-risk pools, is there anything in the statute that forbids abortion funding? Is there anything in the executive order that forbids abortion funding? Congressional Research Service came back, nope. We've done legal research, here are our reasons, boom, 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 no. There's no restriction in the statute, there's no restriction in the executive order. Now, they didn't address the question of whether the additional administrative action by the secretary pursuant to the sort of slush category, whether that was valid. Again, probably. But the fact that that was needed underscored that the statute, the executive order by themselves, not enough. Okay. So those are the problems. Again, there was the sort of overall sense of why we thought this structure would give rise to the problems. There are the illustrations that we had since that time about how effectively they materialized, or we had some near misses that have some lessons. They're kind of validating of the reasoning that we set forward. I want to spend a few minutes reflecting, if I'm not about to run over, on this question of kind of the respective roles of lawyers or analysts more broadly, because there are a lot of policy analysts involved as well as lawyers, and bishops in all of this. So one might say, well, look, aren't the lawyers in their reading of this statute trying to kind of exalt themselves and say, look, you know, we lawyers read it this way. There may be other lawyers who differ from us, but because we're for the bishops, we're special, and so you should give our legal analysis special credence. No, I would never make that argument. I should get fired if I would. We are no more legally correct by virtue of the fact that we work for the bishops. It just doesn't work that way. That's not the nature of the claim. Our job is to try to provide our best educated guess, if you will, about how the law will actually operate. And then the role of the bishops is to say, is that operation morally acceptable or unacceptable? That's kind of the division of labor, you might say. We're not making any proclamations on our own about whether the law is moral or immoral. Because we're Catholics and hopefully reasonably well formed, we have a sense of where the bishop's going to come out on that, but that's a secondary issue. That's not our professional job, and it's not what comes out in our legal analysis. It's ultimately the bishop's question on the moral side. So how the law operates, that's the object of the moral analysis. It's not the moral analysis itself. The bishops do the moral analysis. We report, they decide. Okay, so that's the charge that lawyers have overreached. But there's also a charge that bishops have overreached. You know, aren't the bishops kind of getting into the knitting of the laity, getting into the knitting of legislators, of medical professionals, people who know how these systems tend to work, and, you know, what business do they have doing that? Now, of course, it is true that by virtue of holy orders, it doesn't make you a better lawyer, right? If you're a bishop. Most are not civil lawyers. It's not part of the job description. You know, it's teach, sanctify, and govern, not legal analysis. So, yes, they have no special authority to analyze law of any kind, least of all healthcare law. Again, we accept that fully. But what they do have the authority to do is to morally evaluate those laws. And not only that, that authority is not limited, or authority and responsibility, might I add, is not limited to simple laws, like, say, laws against murder. Law against murder, that's a morally good law. If you repeal a law against murder, that's morally bad. Okay, straightforward. Everybody agrees bishops operate there just fine, but that's not the only place. Right? That's not the only, it's not just simple, straightforward stuff. It can also be in situations that are more complex. Where it is more complex or contested or ambiguous, like you have with a very complex regulatory scheme with healthcare reform, there is a difference, but the difference is an additional layer to account for the uncertainty. So in other words, you're not asking the simple, straightforward question, which is the way it was cast many of the times. Is abortion funding morally wrong? When the law is clear and it clearly provides for abortion funding, then the answer is straightforward morally as well. Yes, it's morally wrong. But what the bishops are having to analyze is a possibility, a risk of abortion funding. Not a certainty, but a possibility. Because there is uncertainty in reality about what the law does. Again, we're not saying, we know with absolute certainty that this is exactly what's going to happen. No, that's not the argument. We're saying there is a very high probability of this. It's inherently predictive, right? We're lawyers. We're predicting what's going to happen when these things get applied. At that point, the law hadn't even passed yet. So there's an inherent probabilistic dimension to what's going on. And so what bishops are necessarily having to morally evaluate is those chances. How much of a risk is a morally acceptable risk? Now, the analogy I have here is to Russian roulette. It's immoral to shoot yourself in the head. Okay. It's also immoral to take a 1 in 6 chance that you'll shoot yourself in the head. It's not any less the role of the bishops to declare Russian roulette immoral because there's that probabilistic dimension in there. You can't take a 1 in 6 chance with your life. You just can't. And the fact that what you're talking about is a probability doesn't sort of remove it from the moral concern of the bishops. That's absurd. Yes, there's uncertainty, but the uncertainty is not something that moves it outside of their competence, their authority, indeed their responsibility. Now, in that framework, what happened in this case? I think what I understood to be going on, and this is, I say here a lawyer's view because I'm sort of describing this sort of as a witness to this, and I am wary of getting in over my head in terms of doing a moral analysis here, but here's the way it looked to me from where I sat. The bishops set a very high threshold for the amount of risk that was acceptable. They didn't come out and they didn't say, well, if you can show me that there's an 80% chance that there's going to be no abortion funding, we're cool. 75? No. That's not the way they think. It's not the way they should think. They didn't describe it in terms of numerical probabilities. But they needed to be very confident. They needed to have a high level of confidence that there would be no abortion funding before they could declare the bill morally acceptable. Now, sort of if there are any lawyers out there, the way we would describe it is the bishops, again, when you have a hammer, everything looks like a nail. So this is, I'm not a theologian, I'm a lawyer, so here's the way I think of this. It seemed to me as if the bishops were saying, okay, you who are proponents of the bill, you bear the burden of proof. You've got to prove to my satisfaction that this doesn't fund abortion. You got to prove to my satisfaction. And not only that, you got to prove it well beyond what we call preponderance of the evidence. It's not just like 50-50 chance. Say, there's about an even shot, it'll fund abortion. I think the bishops will be like, oh yeah, fine, no problem. No, much higher probability than that. Again, to use it in legalese terms, it would be even, I think, beyond clear and convincing evidence, which lawyers think of it as like a 2/3, 3/4 type of chance. It's closer to the criminal conviction standard, proof beyond a reasonable doubt. They needed a high level of proof that there would be no abortion funding. Again, did anybody use these terms with me? No. This is just kind of my own, looking at it through my lens, what I thought I was seeing. Now, if, let's say you're out there, you're one of these players on the field, so to speak, you're one of these advocates, and you say, the bishops are saying beyond a reasonable doubt, that's just too strict. That's too much, that's too high a standard. Then what I would say to them is, well, I understand that you disagree, but that disagreement is an argument where in the division of labor, you lose. In other words, the bishops are the ones that get to set the standard. If you don't like the standard, then you're disagreeing with the bishop in the bishop's realm, as opposed to you're disagreeing with the bishop in your realm as the laity, who are principally responsible for temporal affairs, right? So, they get to set the moral standard. They get to locate the goalposts. If they think the goalpost is too far away, too high, whatever, that's fine, but they're the ones who get to set where it is. Now, after all the dust settled, after all the arguments have been made, you had the in-house lawyers and a lot of other people saying, we consider abortion funding likely. I mean, to go back to the Russian roulette analysis, we were saying 5 out of 6. You pull that trigger and something's going to happen. 5 out of 6. Not 6 out of 6. We're only human, but 5 out of 6. And here's why. And we're going to give you reasons and reasons and reasons and reasons. Because we're accountable to you. And we don't want to steer you in the wrong direction. And we don't want to be accused of steering you in the wrong direction. We know that, there's a lot at stake for us here. We have to be transparent about this. Now, on the other side of the ledger, there weren't so many analyses. there are a lot of people making bald assertions. No, it doesn't fund abortion. What are you talking about? There were a lot of ad hominems out there. Oh, just tools of the Republican Party. Meanwhile, the bishops were pushing for this much against the grain of what the Republican Party wanted, apart from these questions. But when people provided analyses, they were sparse. They didn't provide many reasons, many explanations. They weren't joining our arguments. They were kind of, we're here, and they're like talking past us. It's like, we're just waiting, It reminded me, this phrase often came to mind when I was there, of something a professor said to me, not to me actually, to one of my classmates, when he had asked him a question in the Socratic method in law school, and the student kind of fell a little bit mute. And he said to him, "Make a noise like a lawyer." And so I was just waiting for somebody, please join. We're putting arguments out there. We want to hear counter arguments. You know why? Because we don't want to get it wrong. So if you give us counter arguments, we can say, oh, either you're right, or we can refine it, or you know what I mean? We don't want to be out there just kind of making these arguments and not getting joined. But that was what happened. Instead we had epithets and articles and commonweal and, just not good. That's not the way it should go. So I think at the end of the day, the bishops look at this fracas going on, and they say, well, I don't know exactly who's right, but I can tell you I don't have confidence that this thing doesn't fund abortion. Maybe were the folks, even the folks who were pushing for the law, were they even saying, oh, don't worry about it, 1 in 6 chance. Those guys who are saying 5 and 6, they're out to lunch. Okay, buy it. Accept what they say, 1 in 6 chance. Is it still morally acceptable? No. Again, another analogy. Well, let's see again, this is what I'm saying. Even if we were wrong and there was a lower chance, it's something like 50-50 chance, that's not going to be satisfactory to the bishops. The bishops set the victory conditions on the moral question. We said 5 and 6. Is it 3 or 1? That's still not enough. So the thing is, even if the lawyers are wrong, the bishops were right. The moral analysis ultimately did not hinge on the legal analysis, because the legal analysis was operating sort of in a range of uncertainty that was well below anything that might have potentially satisfied the bishops from a moral standard, from a moral standpoint. So it wasn't even a close call, again, not because our analysis was so perfect, but because the level of certainty that they required was so high that the kind of fights that we were having put us over the question, put us well below that high level. They needed to have a very high level, and they weren't even close to getting a high level. Here's another analogy to a football situation. If we want to be maximally charitable to the folks on the other side of this debate, we're fighting over the 50-yard line. I actually don't think we were fighting over the 50-yard line. I think we had their backs up against the goal line, but put that aside. Let's accept what they say. Okay, we're really, it's, reasonable people can disagree. We're right up against each other. Well, that's fine. But morally, that's not enough. They're not even in field goal range. And the bishops are saying, you know what, even if you were within field goal range, that's not enough either. You got to cross the goal line. You're not even close to that. You're fighting over the 50-yard line. So they're not playing lawyer. We're not playing bishop. Now, I hasten to add that this is not the time for us to be backing away from our legal analysis. We have no reason to do that. We've only gotten confirmation about it. I don't mean to kind of say, well, it really doesn't matter whether we were right because I think we weren't right. No, I actually think more so now than before that we were right. But in fact, I've been surprised at how quick we've seen these things materialize. Right out of the gate, you'd think that for political reasons and otherwise, folks would have held off at least past the election. But no. But as I said, we don't need to be right for the bishops. We don't need to be right legally. We, the staff, don't need to be right legally for the bishops to be right morally. Even if it turns out from here on out that abortion is never funded under this law, at the time that they were making the decision, the bishops did not have enough confidence, and they should not have had enough confidence to be able to say, this is morally acceptable. It would have been playing with fire, Russian roulette, whatever.